Hey there, Teresa here. Welcome to another episode of AI in Healthcare. I'm Teresa Youngkin. I'm a health informaticist. I'm super passionate about technology and how it can better healthcare for everyone. Artificial intelligence, it holds immense promise for revolutionizing healthcare. You've probably heard it 1,000 times over the last 2 years. People talk about how it enhances diagnostic accuracy, how it can personalize patient care. So I'm here to tell you that with any transformation that you're thinking about, the journey from concept to implementation, it's rarely ever straightforward. With AI, we're at a place now where we know what the what is, but we don't know the how. So today I'm going to talk about some common challenges and how the teams that I led overcame them. These are not AI focused solutions per se. But without them, you will never have an AI system that's going to work the way that you intend for it to work. First challenge is data quality. As I was implementing a data governance program, I came across this legacy piece of data. We're going to call it the scrub code. And the term was originally used to indicate the capacity that the provider was working in at the time that they were delivering their clinical services. Let's take a cardiologist. Were they operating as a surgeon? Maybe they were operating as an internist. Maybe they were operating as a PCP because the patient had congestive heart failure and they were the point of contact for all care. So, as you can see, a doctor can have many roles. Over time, that legacy scrub code had become really entangled with the credentialing data, and it was making it nearly impossible to tell what kind of role the clinician was playing. We had to have a lot of real hard conversations during our data governance days about this because we recognized that we were going to incur some technical debt with this. And that was going to be a barrier to any technology that we wanted to use. So we bit the bullet and we decided that we would decouple that piece of data. And it didn't happen overnight by any means. But when we got done, what we had was better algorithms because we had better data, because it had been cleaned and it had been defined correctly. That set the stage for better analytics coming out of our reporting engines. My lesson was that we could tackle that legacy issue because we met it head on with collaboration with all stakeholders that were involved, not just IT, not just the data stewards, but we talked to everybody who used that piece of data in their analytics. And when we did that, we realized that it was essential if we wanted to ever harness the power of that data, but it wasn't just that one project. What it did was it paves the path to any other technical implementation, including AI. Second challenge, integrating with existing workflows. We want it, but it has to be a workflow. If you want a successful deployment of any technology, it really is more about the people and the processes than it is about the technology at hand. So we had started in on this lean initiative and we were trying to identify best practices. And in doing that, we realized that we had to involve the providers in these conversations. And we had to ask them, what did they do? And have them explain it to us. And we gathered input from the providers at every level in the workflow. When we use that approach, that's going to ensure that any solution that we implement is not an intrusive add on, but it's rather a natural extension of their clinical practice. So the lesson here is by engaging those clinicians early on, collaborating with them, we then co-designed a system that improved efficiency. It improved the accuracy in their documentation. You know, at the end of the day, that collaboration, that was key to seamless integration. The third challenge, and this is the biggest challenge I've ever faced in my career, I believe that most organizations face, and it's going to be building trust among your stakeholders. For me, building trust is one of the hardest things to do, especially when you've got data that's changing or your business rules are changing. I was stepping in and running a team while we were hiring somebody else. I gotta tell you that the analysts, when I got there, they were super hesitant to rely on any data that was coming out of the data warehouse. You know, it it's hard when you have a lot of data. You have to make sure that everybody's informed about what's happening with the data, and that wasn't happening. So as a part of the data governance project, we instituted communication at all levels. We did that because we realized when people understood what was happening with the data, it's just a matter of transparency that something had changed. And we needed to communicate that. Productivity went up because they were not scheduling meetings when they had to run reports. They had trust and confidence because they understood what the data was. So, you know, if you have clear communication channels and you involve your end users in every step, you can build the trust that's necessary to drive real change. I'm going to be at HIMSS next week. If you're going to be at HIMSS, let's connect. Send me a DM here. I would love to have a cup of coffee with you. I will be here again next week, broadcasting from the floor of HIMSS. I'll catch you guys here again on the flip side.